Welcome back to 12 in Our Schools. I'm Brian Jenkins. It is a very tough situation when any family has a child whose health is serious enough to keep him or her in the hospital for weeks on end or perhaps even longer. Well, thanks to some forward-thinking hospitals, meeting those kids' educational needs doesn't have to stop. With me now are Joanne Malta and Florence Carano. Both teach long-term child patients at the Bristol Myers Squibb Children's Hospital at Robert Wood Johnson University Medical Center. They do some very special work, and we thank you both for joining us today.
Thank you.
I want to talk about some of what's different between being in a classroom and being in a scenario where you have kids who obviously have many other things on their minds and bodies that they've got to deal with. How do you overcome that?
Well, I think, you know, I was a survivor when I was a teenager a long time ago, and I kind of understand the difference between being in a classroom and being in a hospital. And my job really is to get them out of the rooms, and the kids understand that they're a student first. Cancer is just a second thing that's happened to them, and it's not them. So we kind of encourage them to get out of their rooms, take their minds off what they're doing with the cancer, and just get back into the classroom.
How has your personal experience molded what you bring to the equation now?
I think there's an understanding, and I think with the connection with some of the kids, I don't tell all the kids that I was a survivor, but I do tell the teenagers and especially the parents. I think the parents understand and they connect more, and they see kind of a hope there that I didn't expect when I took this job that would actually be. And so I think when they say, listen, I've been through this, I've been without this education program that Embrace has brought to the hospital, and I had to sit through summer of, you know, getting through the schoolwork. If you do it now, then we can get it done, and then you can go back to being a student when you get back into school.
Joanne, I want to ask you, is there a difference in how you approach different age groups and those who react or respond to you? Say you might have a different approach for a first or second grader versus a sixth or seventh grader.
Yeah, well, with this position, I teach kids on all different grade levels, from preschool all the way up through students even taking college courses. So every day it's something different, and you know, you have to approach it in a different way for each student and each of their individual needs. Is
it difficult for you leaving your personal side and coming into it, especially a kid who's dealing with a lot at one time?
Yeah. I actually have a personal experience with it. My daughter was diagnosed with cancer at 9 months, so I would never have been able to do this job without having, you know, that to draw on. You know, our goal through this education program is to bring normalcy back to this child's life in, you know, a situation that is anything but normal. So I just think about that and, you know, keep focused on the goal that their job is to do the schoolwork and get them back right into being a student.
Do either of you find that you have to kind of push the parents aside because the kids may be more receptive to what you're doing?
I think that sometimes, yes, we definitely have to kick the parents out and say, listen, we've got them. It's a scary time for the parents. It's hard to let go, even if it's right down the hall. And sometimes, you know, it does take a little coaxing from the parents. Listen, this is the best situation for you and for your student to get out of the rooms and get back into being a student again. Eventually, most of the kids, I don't think we've had one parent that really said, we don't want this program, because then they eventually see how, you know, great it is for both the parents and the student.
I would imagine from a parent's perspective, they're looking at this as the victim, and you've got to take the patient out of the victim mentality to say you can rise beyond this. Is that kind of a good characterization?
Yeah, definitely. That's exactly what we think. We want to see them first as students and treat them as students and get through their schoolwork. But you know, a lot of times with the parents, that may not be the top priority, but that's our goal. That's our job.
Talk about the Embrace Foundation. This is a big part of what you're doing.
Right. Embrace Kids Foundation is a nonprofit organization that works solely with the hematology and oncology students. They have many programs. The education program is the second largest program that they have for all our patients. They do a palliative program. They do the education. They do a range of different things from parties, but the education program was started years ago just as volunteers that were coming into the hospital, and then they saw the greater need of how important it is to have full-time teachers there, certified to communicate with the schools, to go into each school that the child goes in, we'll go in and we'll say, listen, this child needs this service with a 504, or classify them as other health impaired. So Embrace saw the bigger picture and then said, this is the need that we need, and so they brought teachers in.
So you're actually in concert with their school.
Yes.
In other words, you'll go to talk to the school and say,
Right.
okay, this is what they're working
work
on,
from
and
them
that kind of thing.
Right.
Yeah, we work closely with the schools.
Yeah, we'll go in and get the schoolwork from them. We'll get a second set of books for any teenagers or little kids, and we'll contact each teacher individually, and we'll tell them, listen, what do you want us to work on? They're missing this week, or they're missing a month, or they're missing the whole school year. What do you want them to learn? And we're in daily contact with each teacher in each school.
Now, do you have to incorporate the nurses to some degree with your program if, let's say, a kid has to be medicated at a certain time, or or you're in the midst of what you're doing, and nurse comes in and says, oh, we've got to do something else? I mean, is that a kind of an odd mixture for you at all, or have you gotten accustomed to that?
No, that's very accurate. We have to figure out when medications are going to be dispensed. If they have to go for a procedure, it's all part of their day. So we work around that.
Right. We actually have like a schedule board on our door that places each kid in a schedule, and then we'll ask the nurse, can we, does this work? And we work together. And they'll come in the classroom if they have to give, a certain chemo or something. They'll come into the classroom, and they know it's at a safe environment to do that. So it works. We make it work. So we're flexible.
I'm curious, in a conventional classroom setting, you might have kids that drift off or get bored, or you gotta do something to it. But in this case, I would imagine what you're doing is a welcome distraction.
It is. I mean, there's times where kids will literally come in and throw up and then go back to their rooms and then come back right in. There's something that, even though it's school, it's something different. It's, it gets boring to watch TV all day when it's, there's nothing on TV. And eventually they're like, okay, let's do school. Yeah. And so it's amazing. I tell my kids, 3 weeks ago when you weren't sick, you would be home for 3 days, and now you're coming back in this, the room, and,
wow. Well, let me stop you. We're out of time, but you guys do great work. I'm sure a lot of parents got their hats off to you. Much success to what you're doing. Straight ahead on the show, we'll tell you about this week's Scholar Athlete of the Week. Stay with us. 12 in Our Schools will be right back.